am now at the Falmouth Hospital in Trelawney, where the COVID ward, which has been constructed over the last few months, is now ready and fully equipped to be open, and indeed this weekend will begin to house COVID patients, about 6 patients initially to come in. The ward is very modern, has all the infrastructure, including the piping for gases, the beds, brand new, all the other equipment to support COVID patients who are critically ill or relatively ill. It is 36 beds. It is well landscaped, easy access for patients to come in. We have gone ahead and recruited doctors and nurses, additional staff who will be manning the wards and the patients, and we are in effect ready to add this additional 36 bed capacity to this hospital. Now, Falmouth, in a sense, has been a big beneficiary of COVID and the collapse of the Cornwall Hospital main building. When we started out, Falmouth had less than 100 beds. Today there are 220 plus beds here, and the staff is very motivated. They have worked hard and they have really risen to the occasion to support the COVID and other critical health-related efforts in the region and in the parish. I want to thank those who have made it possible, the region, the hospital, the project managers, the contractors, and just to say, let us continue to work together to provide treatment through these facilities, but also to observe the protocols, so if we don't need to, we don't have to use the facilities that are available. But good job. COVID ward ready to roll here at Falmouth Hospital. Beautiful structure, and I'm proud of the work that the team has done, and really I'm happy with the finished product.